dari Belanda, Dr. Zina Nimeh, bagaimana mendukung perlindungan sosial yang berkelanjutan. Artinya, bisa saja situasi pandemik 19 ini bisa terjadi yang akan datang. Ini yang dimaksud dengan pembelajaran penting. Sehingga kita akan memperoleh pembelajaran bagaimana seharusnya kita merespon, bagaimana kita seharusnya melakukan pola-pola penyesuaian yang lebih adaptif, yang lebih updating, sehingga tepat sasaran. Mengapa ini penting? Karena basis sosial, keterpenuhian kebutuhan sosial di masyarakat, setidaknya itu akan menjadi katup peredam pada situasi-situasi yang lain. Dapat dibayangkan ketika persoalan perlindungan sosial ini tidak dilakukan dengan cepat, tidak dilakukan dengan sustainable, tidak dilakukan lebih adaptif, maka akhirnya akan membawa efek yang lebih jauh, lebih luas. Bukan hanya ekonomi, tapi pada sisi politik. Mohon maaf, saya ulang. Terima kasih kepada para pembicara yang telah hadir. Saya ulang bahwa terima kasih kepada Mas Dinar Karisma, kepada Dr. Zina Nimeh yang telah bersedia hadir untuk menjadi pembicara pada webinar kali ini yang diselenggarakan oleh Pusat Studi CSR, Kewirausahaan Sosial, dan Pemberdayaan Masyarakat. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selanjutnya, semoga webinar ini kita akan memperoleh pembelajaran yang baik dari Belanda dengan pengalamannya, kemudian juga dari Indonesia melalui Kementerian Perencanaan Pembangunan Nasional yang mungkin ada pengalaman-pengalaman penting bagaimana mensiasati sebuah program yang lebih adaptif, yang lebih responsif, yang lebih sustainable. Karena kita tidak tahu pada yang akan datang akan terjadi situasi-situasi yang mungkin saja bisa lebih buruk. Melalui proses pembelajaran yang saat ini sedang berjalan, situasi pandemik 19, semoga kita bisa belajar lebih banyak bagaimana kita melakukan proses perlindungan sosial kepada masyarakat, baik pemerintah pusat, pemerintah daerah, juga kita para akademisi, para mahasiswa, pemerhati, bagaimana kita membangun sebuah perencanaan pembangunan dalam konteks social protection yang lebih responsif, lebih adaptif, bagaimana membangun sebuah perlindungan sosial yang berbasis dari masyarakat, yang dimunculkan gagasannya dari masyarakat, karena tidak semua perlindungan sosial itu bisa dipenuhi oleh pemerintah. Dengan negara seperti Indonesia seperti ini, perlu juga membangun sebuah perlindungan sosial yang berbasis pada masyarakat. Kita juga berterima kasih kepada Dr. Zina Nimeh yang bersedia untuk berbagi bagaimana melakukan perlindungan sosial di negaranya, juga mengkaji perlindungan sosial di beberapa negara. Dari sini pun nampaknya semua kita bisa belajar. Isu ini harus kita bicarakan terus agar makin matang, makin konsen sebagai bagian upaya adaptif, upaya penyesuaian diri agar kita menjadi warga masyarakat yang lebih punya daya lentur yang kuat. Bukan hanya pemerintah, tapi juga masyarakat pada level yang lebih bawah. Semua belajar dari situasi ini. Ini adalah situasi yang baik untuk membicarakan ini, untuk mendiskusikan ini, agar kita bisa memperoleh pembelajaran yang lebih baik, agar kita siap untuk ke depan. Pandemik tidak akan hilang, maka kita harus siap move on dengan upaya-upaya apa, bahkan kita bisa membangun sebuah pola perlindungan sosial yang lebih baru, yang lebih mandiri, yang lebih bisa diandalkan ke depan. Terima kasih kepada Bu Titi, Kaprodi Pasca Ilmu Kesejahteraan Sosial yang telah menggagas ide kegiatan ini. Ini menjadi wahana untuk pembelajaran bersama, dan kami mengundang juga para pemerhati akademisi dari Asosiasi Pendidikan pekerjaan sosial dan kesejahteraan sosial seluruh Indonesia, juga berbagai pihak, para mahasiswa, baik mahasiswa pasca maupun mahasiswa undergraduate S1, agar mereka dari sejak awal dikenali, agar mereka dapat belajar dari orang-orang ahli, dari orang-orang pihak-pihak lain yang expert, yang paham, dan kemudian didiskusikan agar penguatan pemahaman ini bukan hanya sekedar knowledge, tapi bisa menjadi ilmu yang nanti bisa diaplikasikan di masa yang akan datang atau juga pada saat ini pada konteks situasi lingkungan di masing-masing. Demikian yang bisa saya sampaikan. Terima kasih kepada para peserta, kepada para pembicara, serta tak lupa kepada panitia yang dari sejak awal mempersiapkan kegiatan ini jauh-jauh hari. Mohon maaf apabila ada kata ucap yang tidak berkenan. Terima kasih. Selamat mengikuti webinar. Semoga diskusinya menjadi lebih produktif dan bermanfaat buat kita semua. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih kepada Pak Santoso. So Zina, I will try to translate this. I mean, what have been said by Santoso, but actually I will merge that with my welcoming speech to all of you. So Dr. Santoso said, thank you for you and Dinar for your participation in this webinar, and also he welcomed all of the participants who are coming from different background. Some of them are lecturers, some of them are students from social welfare and also from other discipline, and some of them joined the Association of Social Work and Social Welfare Education in Indonesia. So since the beginning of 2020, we know that the world has been facing a crisis due to the spread of COVID-19 pandemic. So this major public health challenge has forced government and society to face double challenges. At the same time, they have to control the pandemic and also responding to the social and economic impacts resulted from the pandemic. And in Indonesia, we witness how COVID-19 has strongly burdened the healthcare system, slowed down the economic growth, increased unemployment and poverty rates, and increase the vulnerabilities of women, children, the elderly, urban and rural poor, and so on. And as Dr. Santoso said, this is time to reflect for all of us about how the social protection should be. And as International Labor Organization said, COVID-19 crisis has exposed devastatingly a big gap in social protection coverage in developing countries, and recovery will only be sustained, and future crises will be prevented if they can transform ad hoc crisis response measures into comprehensive social protection system. So I think what I said is trying to resume what Dr. Santoso said. So he expects that our webinar will benefit all of the participants and will be a kind of support to promote a better social protection in Indonesia, especially. And so that's why our today international webinar will talk about responsive and sustainable social protection, a lesson from COVID-19 pandemic. All right, to all of the participants, I would like to remind you that please mute your microphone, and if you have question, you can raise hand or just write down in the chat room. So I can monitor all of the questions that you raise, but we will have the discussion after the presentation. Before the presentation, I would like to introduce our two excellent speakers. The first one is Dr. Zina Nimeh. Dr. Nimeh is an assistant professor at United Nations University Maastricht Economic and Social Research Institute on Innovation and Technology, School of Government in the School of Governance in the Netherlands. She is the coordinator of the Master Specialization in Social Protection, Family Financing and Budgeting as part of the MS Master of Science program in Public Policy and Human Development. Dr. Nimeh research interests include multidimensional poverty, social exclusion, inequality, social stratification, citizenship and social protection policy design with a regional focus in Middle East and North Africa. Dr. Zina Nimeh studied finance at Xavier University in Cincinnati, Ohio, and labor and human resource at the Ohio State University in Columbus, Ohio. Both are in the United States. And she obtained her PhD at Maastricht University through a prestigious Mary Carey Research Grant, and her dissertation has been recognized as the best dissertation in the Netherlands in 2012 by Dutch Political Science Association with the title Social Citizenship Rights, Inequality and Exclusion. And in addition to being the lecturer at the university, she had managerial and consulting experience in the areas of human development, social policies, and public sector reform with focus on employment and education. She has applied experience in policy development and implementation and continues to work as a consultant for the International Labour Organization and UNICEF. That's about Dr. Nimeh. And I'm going to read the summary of our second speaker from Indonesia. He has a very amazing and long resume, but I can give you some short if Dinar doesn't mind. Okay, Dr. Dinar Dana Karisma is also a lecturer for social protection class at our Master and Social Work program at FISIP Unpad. He joined us recently, and he got his first degree from Faculty of Economics, Universitas Indonesia. Dr. Dinar earned 2 magister degrees in law and diplomacy at Tufts University in United States, and in social policy from Brandeis University in United States. And he just graduated from a PhD program in social policy recently in 2020, especially in health policy in developing countries in the United States. Dr. Karisma obtained many honors and awards from reputable international sponsors, including Fulbright, AusAid, the East West Center, and so on. And his working experience, currently he works for Ministry of National Development at Policy Planner at the Directorate of Social Protection and Welfare until 2019, and is currently work at Directorate of Poverty Alleviation and Social Welfare. He ever worked at Center for Global Development and Sustainability at Brandeis University, and also at National Coordinating Team for Poverty Reduction Acceleration. So I mean, all of the participants, we are very blessed with the 2 speakers, and we would like, you know, we can wait to, you know, to listen what their presentation about. So I will give the first chance to Dr. Nimeh, because she will explore the social protection issue from more global context. And Dr. Karisma, Dr. Dinar will talk about Indonesian context. So I would like to allow Dr. Zina Nimeh to present her presentation. Please.
Thank you very much for this very kind introduction. So I prepared something. Let me see if I can say it correctly. So so you say selamat pagi, and saya senang berada di sini. Did I say it right?
Yes.
Assalamualaikum.
Selamat pagi.
Selamat pagi, Bu.
Hello. I'm very humbled to be here, and I want to thank Titi very much for this very nice invitation. And I'm very also happy to be talking alongside with Dr. Karishma on this topic. And also, you know, I couldn't understand a lot of what Dr. Santoso was saying, but some of the things that resonated actually when he was saying was something that was very, that resonates, and you will be hearing about it in my presentation. So I'm going to start sharing my slides. Let me see if I can do this properly. And here we go. I think I need to put it on. Yes, so okay. So no, this is the, yeah. Okay, so what I'm discussing today is really a much more broader perspective on social protection and what have been some of the lessons learned. I think it's very difficult to start already talking about lessons learned because we are still in the lesson. However, what I thought that I would like to present today is how actually this could be an opportunity. And I think this is what I understood also from Dr. Santoso's talk, is that this could be an opportunity for us to really actually start to promote sustainable social protection. And sustainable is a very key word in this. I would like to start by just drawing your attention to how in the past years, we've been having several issues that are very abstract, but at the same time, very problematic. And these mainly are the rise of inequality and instability and insecurity in the world. Even though we know that poverty reduction has benefited from important progress, we find that inequalities in income, uneven access to services, resources, and opportunity indeed remains a big problem, especially when we look at different country contexts and we look at urban and rural, gender, ethnicity, several divides. This also leads to what we see, this rise in instability. The world is experiencing a swell in political, economic, and climate instability. And we see this actually in much more conservative regimes. We see trade wars, natural disasters, and these in turn are triggering compound vulnerabilities to more globalized human, the migration aspect, but also potential health crises, such as water, food shortage, and pandemics, with financial recessions also looming. So actually, I was very happy to hear a couple of days ago, as you guys might have heard, that the World Food Programme has actually received the Nobel Peace Prize, which is a very important outcry for this crisis that we are facing and could be facing when it comes to water and food shortages. In addition, we find a lot of insecurity on the rise in the form of more individualistic and nationalistic protectionism, resource conflicts alongside social displacements and tensions where civic, gender, indigenous, and other rights are increasingly under pressure. Perhaps the question that arises here is that what is different? This has always been the case in the world. People fight over resources, there are pandemics. But what has changed is that the speed of acceleration is faster than ever. But what has also changed is that we now have much better tools that can help us in dealing with such crises and managing such crises. And here comes this argument for social protection. Social protection can actually act as an important stabilizer, and I hope that your interest in coming to this event today is an evidence of that. It is timely to invest in more strategic and systematic social protection systems. And here I would also quote to the SDG 1.3, where it said, implement nationally appropriate social protection systems and measures for all, including for, and by 2030, achieve substantial coverage for the poor and the vulnerable. So the time is now for us to really start to think about social protection as not just a key tool in crisis management, but actually in a stabilizer in socioeconomic and conditions. Now, as I was preparing for these lectures, I was very impressed to find what Indonesia has been doing on social protection. And I give a small quote from a publication by the OECD, which was a review, system review on social protection in Indonesia. I have the resource down there. And why did I want to quote this is because I find it always, whenever we are talking about social protection in different countries, that we first get sort of bogged down with a definition. What do we mean by social protection? And what I was very happy to find out when I was investigating the case of Indonesia is that according to the government of Indonesia, that they talk about comprehensive coverage to the entire population. They talk about coordination between various institutions. And actually the goal of such programs, such as social protection, is actually to reduce poverty, extensive vulnerability among individuals who have emerged from poverty but have not yet joined the middle class, long-term demographic change, and particularly population aging. When we look at all these things, we understand that Indonesia is actually in a position that is very ready to be able to take on more structural discussion and more advanced measures when it comes to social protection. And that's actually the harder part. It's much easier for us to start establishing systems, to start to establish cash assistance programs. It becomes much easier, difficult, or much more challenging when we start to talk about systematic structural changes. And I will come to that in a moment. I would like to start here, aligning it with what we have, what I've presented in terms of what Indonesia, how Indonesia sees social protection, is the base of a lot of the work that we do, whether it is the teaching that we do at the university, but also the work at the ILO, and to an extent also at UNICEF, is this universal social protection idea for shared prosperity. Many of you might have heard of the social protection floor, which I will discuss in a second. But the idea is that if we want to start truly thinking about social protection constructively, we need to start to think about nationally defined sets of basic social security guarantees that ensure as a minimum that over a life cycle, all in need have access to essential health care and basic income security, which together secure effective access to goods and services defined as necessary at the national level. So we're talking here about essential social rights and transfers. We start with the safety nets for the poor that provide the minimum income livelihood for the vulnerable population, and that facilitates access to essential services such as healthcare, geographical and financial access to essential services such as health, water, and sanitation, education for all, and social work. So the idea here is that we think of social protection as this comprehensive universal system that doesn't just stop at assisting people who are vulnerable, but rather it is part of a much greater system that ultimately is supposed to allow citizens to thrive. And here I would like to spend just a couple of minutes contrasting when we talk about social protection. A lot of times what people think we are referring to are safety nets. Whereas when I'm talking to you about social protection, and I think with a concept as sustainable social protection, responsive social protection, adaptive social protection that looks at the country as a whole, we are talking about something beyond safety nets. So as you see in the table here, there are different objectives, types of interventions, and benefit levels. However, it is important to know that safety nets, such as cash assistance, are really risk coping mechanisms that are supposed to be transitory response measures, meaning it's a response measure that is in transit. You know, when you're traveling from one place to the other and you have to wait, stop in a country to wait for your flight to go to your destination, you're in transit. You cannot, this is not the final destination. Whereas when we think about social protection floor, that is a rights-based, systematic insurance against poverty for all residents, and you build up from that. So let's talk about COVID-19 and the need for social protection strategies. Now, I'm sharing with you here the top 20 coronavirus packages as a percentage of GDP. Now, of course, there's many questions. How is this calculated? And you could come and argue that perhaps that's not the most ideal way of calculating. That's actually from a BBC news outlet, so it's not really that academic, but I just thought sort of to give you an idea. And the message I want to send with this slide is, as you can see, the biggest responses have actually occurred in countries that are richer and older in terms of age groups. And those who are not older, they are relatively richer through the types of resources that they have. So for example, you can see Qatar there. Iran is there, even though Iran, we know, due to the sanctions that they are facing at the moment, it's a different situation. But the message is that while the richer countries have been able to cope, and I will discuss this in more elaboration when I explain the case of the Netherlands, poor countries, even though they have prepared responses, they've tried to, they have an issue from a monetary perspective. And that's why a lot of international organizations have been trying to get on the bandwagon to help. But if you are not already established in a social protection system, it's been and going to be very challenging. So the message is that it's easier if a floor already exists. And I will demonstrate that in the case of the Netherlands. Those of you who have been visited the Netherlands, this is a picture, the one to the left here from the Dam Square. As you can see, it's completely empty. I think as many of you saw pictures in the world during the beginning and the onset of the pandemic. This is also a photo of a shopping shelf. This is I think a pasta shelf where people have come and just ended up overbuying. You see people standing in lines to buy their groceries. And then you also see that a lot of rules started to come about in terms of public transportation, etc. But that was the panic phase, right? This is the phase where none of us knew what was going on. It was very stressful. But at the same time, it was also very uncertain. Nobody knew what was going on. For the first few weeks when we were told, for example, that we had to quarantine, we didn't know how we were going to work. Everything was all of a sudden. But I think the whole world, in a very nice way, shared these few days. As dark as they were, at the same time, they showed how vulnerable we are all as human beings. But things started to change. And this is where governments that have more structural system, governments that have social protection floor in place, the difference started to happen. And I here would like to quote an anecdote from one of the consultancies we were doing in some of the discussions with countries who are trying to set up COVID emergency packages for social protection. Someone said, the corona is not a bad thing if you can afford it. And that applies not just to individuals, but that applies to countries as well. So actually, a lot of governments have started to implement fiscal and monetary measures if they could afford to, and if they have the power to do so, and they have the systems to do so. And I will discuss a little bit about how it was in the Netherlands, just to give you an idea. So let me see. Yeah. So in the Netherlands, up until now, over 33 billion euros have been paid in emergency aid, 8 of which went directly to firms. So there was a series of fiscal measures that were introduced since the start of the pandemic to contain this mainly economic impact of the outbreak. And these measures were divided into a variety of schemes, and I will explain in a second. So at the beginning, the first one was something called the NOW, we called it, which was allowance for wage costs. And the idea there is that for people, entrepreneurs and workers who need time and space to adapt, they were actually given these allowances. All that you had to do was to be able to apply for them. They could come up to 4,000 euros, for example. You don't have to pay them back. They're emergency sort of amounts of money that can help you stand on your feet in case something is going on. Now, the idea is if your business is falling, etc., That's not where we're coming. We're coming to see how this can help you just stay afloat. The Toto, which is an income support for the self-employed. So for example, if you have freelancers, you have some entrepreneurs, self-employed people, which is actually, this is one of like the most critical areas of where support was needed. They also received additional income support, but also opportunities from the different municipalities and governorates to be able to receive, for example, different types of training and different kinds of benefits. Then we had what was called the TVL, which was allowance for fixed costs for small and medium enterprises. And basically this tax-free allowance, was aimed at, it gives companies sometimes up to 90,000 euros. It can be extended, but the idea is that it allows you to cover the costs for employees so that you don't have to fire anyone. So actually one of the conditions is that you cannot fire anybody. And of course, the government was always saying that we understand. There's a weekly press conference by the Prime Minister, always sending the message that we know in the coming months, people will lose their jobs, people have to look for other jobs. But we want to make the transition from current situation into better future prospects. They kept talking about how the cabinet wants to help people, and that there's a lot of, actually now they're thinking, and this is where this responsive social protection comes in. We understand people are losing their jobs. The money is not just in helping you, but in maybe helping you also start to see how you can find different jobs. Maybe we can invest in some kind of training. And the focus is on the young people. So the cabinet started to say, okay, let's not just think about coping programs, but we need to also think about mitigation and programs, and also preventive programs for the future. So even though with all of that, the situation has not been easy. However, it's not as detrimental as other places. So actually at the end of the day, you will be okay. If you are running, your job is you don't have a job, you will be okay. You're not going to have a problem, feeding your kids. You're not going to have a problem taking your children to school. You're not going to have a problem having the minimum level of standard of well-being. You will not have that, because there is a social protection. It is adaptive. It has been responsive. Yes, it's imperfect, but it is there. Now, keeping that case in mind, and the reason I wanted to use this case is just to show you that it is very easy to talk about responsive social protection when the system is already there. Now, what have we seen around the world, which is very interesting, because even though like the example of the Netherlands I showed you was a very comprehensive example, different countries have tried to do this, but it has been much more incremental. And this is really a question of, fiscal availability. How much money does a government have to be able to support and sponsor? One of the main things we saw globally is that a lot of government tried to guarantee access of health. And a lot of that, and actually quality health as well. A lot of countries try to mobilize additional public funds to boost budget as part of their emergency response, while at the same time safeguarding and extending coverage of social health protection mechanisms during and beyond the crisis. The Philippines, for example, the Philippine Health Insurance Corporation released about $500,000 in advance to accredited hospitals as part of its COVID-19 response. And it used what was called an interim reimbursement mechanism to provide healthcare providers with liquidity to respond adequately to the increased demand. And it then established a response package that it included a COVID testing, referral, and isolation. So they were very fast from that angle. Thailand provided also another good example on how they dealt with the guaranteeing access to health, where they extended financial protection against health expenses to both national and foreign residents with a valid work permits. And that's another point I want to discuss in a second, valid work permit. So if you become a patient of COVID and you have these permits, you get universal coverage if you're an emergency patient. This way, patients were able to seek treatment at their nearest public or private hospital free of charge. And these were very fast actions to contain the pandemic as much as possible. Another very critical issue that has emerged, and this is actually, if I would say, in Asia, Southeast Asia, that has been a very critical issue and has been a very critical challenge. It is a challenge already, which is how do you protect workers in the informal economy? You have a problem of these workers that are important for the economy, but you also have a problem of outreach. You don't know where they are. And the idea is to protect workers in the informal economy by pursuing innovative policies to reach them quickly through a combination of non-contributory schemes and facilitating their transition to a formal economy. Two interesting examples on that were Vietnam. So they had what they called a crisis response initiative, and they decided to provide cash transfers to individuals who have lost their jobs but are not eligible for unemployment insurance because they don't participate. So this actually included workers that typically have high levels of informality, for example, street vendors or waste pickers. Additionally, family businesses that had a tax declaration of less than a specific amount, who had to suspend their businesses, were also offered these cash transfers. Namibia also had an emergency income grant, and then they would provide a one-time benefit, which was about, I think, around $50 to support workers who have lost their jobs and do not benefit from any other grants. And the government actually sort of tried to piggyback also on that, where they actually utilized some form of an enrollment mechanism. So they used mobile technology. And this is a fascinating, actually, point, which I am also starting to see in a lot of countries where they are trying to collaborate with mobile providers in order for them to understand better how the demography and actually the financial situations in a lot of those countries, and especially poor areas, are. And basically what they do is that you can sign up and you will get paid. And what is very interesting about that is that actually if you don't sign up, you don't get paid, but you've never signed up in anything else before, and now you've signed up. So a lot of countries actually have used this to kind of get a better number of people who are working but are not registered. So, but this actually remains a huge challenge, not just for now, for dealing with it during the pandemic, but also on how to provide support. We actually, the number is around 1.6 billion informal economy workers. So you know, this is a huge number. If the numbers are correct, I think this is an approximation. The other point is that enhancing what we call income security. So this is mainly what a lot of people who are not in the social protection field think is mainly done in social protection. And basically it is enhancing income security through cash transfers by increasing benefit levels, extending coverage through existing new programs. And here becomes this very interesting thing about adapting. So a lot of the countries actually decided to adapt entitlement conditions. They made it maybe easier. They dropped some of the obligations and facilitated delivery mechanisms. This was ensuring that there's this humanitarian cash is there, and you can use it to further, you know, solidify other systems that are in place. One example is actually in Ecuador. So they put in place in Ecuador what was called a contingency benefit. And it was directed at, you know, both actually everybody who is affected, but also unaffected in the informal economy. And it was distributed through, you could actually use the existing social protection, social assistance programs that are there to distribute it. But you also told people or announced that people can come and apply and ask for that. Morocco as well, they did something similar, and they also said that people could actually apply for these kind of assistances, and they actually used SMS. They actually said to people, you can receive this income support. You just need to send the message, and this will be so. So the idea is that it was facilitated. Yeah, and I mean, also the Philippines, I didn't include that here, but the Philippines, for example, they have a flagship, a very famous cash transfer programs. They suspended conditions for the period. So for example, if you're part of this cash transfer, you have to do school visits and attend school for kids. They actually said, okay, let's stop this for a bit, and then we can pick it up once the situation starts to improve. The other more straightforward thing was actually unemployment protection. And here, the idea is that you want to continue protecting the incomes and jobs, promoting decent works. And you have already, in a lot of countries, existing unemployment schemes. And these just continued. I think this was very easy to already put in place. The challenging issue here is that you're going to start to have much more unemployed. So you're going to eventually start to face an issue of funding. But that's one thing. The other thing is we also need to realize that not so many countries can actually draw on unemployment protection schemes. Because, what we know is that before the crisis, only 20% of unemployed persons worldwide, that's 20% only, are covered by unemployment benefits. So actually everybody else is left without coverage. So coverage rates, and in Africa, for example, coverage rates are very low. Also in Latin America. But nevertheless, where such schemes exist, they have shown to be very, very useful in the face of this pandemic. So overall, the idea is that countries need to think about mobilizing resources on this basis of solidarity. And this is a very long argument. We can have a complete discussion about how do you use solidarity locally, nationally, internationally. But the question, the million-dollar question, if you want to call it, how do we mobilize these resources? We need to mobilize resources at national and global levels. And we have to consider a wide range of options to increase fiscal space for social protection, keeping in mind some measures need time to take effect. So countries actually should consider a variety of different methods to mobilize resources for social protection, taking into account what are the capacities, the contributory capacities of their different population groups. So in principle, a national social protection system should be financed from national resources. But we also know that this is not easy. This is not a straightforward endeavor. I'm going to share with you here, and I mean, for those of you, you can take a note of that. This is a fascinating, site from the IMF, where actually you have, if you go into this website of this link on their website, you have the response, the financing response, also including maybe perhaps in some cases of development assistance, but of all the countries. So you actually can go there and you can see from a fiscal perspective and from a monetary perspective, what every country up to, I think, October 8th or 10th, or the soonest data you have, what they have done. So you can see that governments have done, I think we have at this point, if you try to calculate, we are talking about 1.3 trillion US dollars to help countries tackle health socioeconomic effects caused by the crisis. Now, not everything is starting to be deployed right away. But here becomes a very interesting challenge. All the numbers that you see are numbers that have been promised, right, and allocated. But we also know that a lot of times not all these allocations ultimately make it. So it's very important to keep that in mind when we are actually thinking about how these things work. But I recommend, if you're interested actually in different financial, fiscal and monetary assistance of countries, to actually look at this site. So I'm coming towards the end of my presentation, but here's the main message. And I think my favorite sentence in this whole since we started doing, work on this post-COVID or COVID crises for social protection, it's this rebuild better. That we have an opportunity, if we are social protection specialists, thinking about actually the positive output, or the positive not outcome, I would say it's just mainly at this point, it's an output still of a lot of these countries. We need to seize the opportunity provided actually by COVID-19. I think this is a wake-up call to accelerate building universal social protection schemes, including the social protection floors. I think in a couple of years, in 5 years maybe, when we in a year when this starts to finish, but actually in 5 years when we've done all the research, we've collected all the data, I think we're going to find out that the countries that came on top aren't necessarily just the rich countries, but the countries that were able to utilize social protection systems, safety nets that were in place. When we want to think about promoting sustainable recovery, we have to think about coordinating employment and social protection policies in a more systematic way, so as to promote sustainable recovery. We have to ensure sustained efforts to build national social protection systems. And we have to accelerate this progress toward universal social protection systems for better recovery. There is no particular example on this. However, we know that we hear a lot, and this is especially recent since also the crisis in Syria, what happens in the Middle East. But we hear a lot about these what we call rapid assessment surveys, and that the ILO conducts. And actually, the idea is that we need to figure out, is through some sort of a mapping and future outlook, how can we build adapted measures to strengthen social protection and skills development, usually in this case, for refugees or migrants, but also national workers, and to work together into thinking about the future. And this is becoming, it's slow, but that's sort of where we are headed. I think as an, if you want to call it, as the industry of social protection. And I would like to close with this discussion on the global partnership for universal social protection to achieve the Sustainable Development Goals. As you see in front of you, these are the different elements of this global partnership. The International Human Rights Framework, the International Social Security Standards, and the 2030 Agenda set out a clear, internationally agreed framework for achieving universal social protection. And what the current crisis shows more dramatically than ever, that countries need to live up to their commitment to develop nationally owned social protection systems. The global partnership for this universal social protection to achieve sustainable development goals, which is co-chaired by the ILO and the World Bank, it brings together governments, international organizations, social partners, civil society, and basically calls upon countries and development partners to undertake these steps. And I think this is a very, very opportunistic time where governments can actually build on that, to be even maybe more proactive in pushing for that and actually asking for support when it comes to that. And I will close by showing you this quick graph of the social protection floor on how it was supposed to look, was supposed to come out in a different way, but just to show you super quickly, what are we talking about here? That we can start, every country can actually, first of all, do an evaluation of where does it stand in terms of access to essential healthcare and basic income security. Where does it stand in terms of social security benefits and also with voluntary insurance, and try to set up what we call this comprehensive social security systems on the basis of a floor for all. So it is an equation that looks at the difference, on the horizontal the dimension on the how the individual and household incomes fare from low to high, but also it looks at building up on different levels of protection. So governments would have extension strategies that will build on what we call a social protection floor to include social security benefits and voluntary insurance under government regulation. And the idea is that outcomes can be guaranteed through different means. There is no one-size-fits-all policy, and that government should actually, together through collaboration and dialogue, establish this formula. So I'm going to stop here, and I thank you very much for your attention, and I'm happy to answer any question later at the question and answer session. Thank you.
Okay, thank you, Zina. Ada beberapa poin. I'm trying to translate, just give a brief translation to the participant. Jadi ada beberapa poin penting yang disampaikan oleh Zina terkait dengan presentasinya. Saya pikir Zina telah mempresentasikan beberapa poin penting ya, yang memperkenalkan ide social protection floor. Jadi kalau sekarang kita masih berpikir tentang safety net, Zina mengemukakan tentang konsep social protection floor yang sebenarnya jauh lebih komprehensif karena bersifat universal. Ya, artinya social protection yang bersifat universal yang sebenarnya penting untuk dipromosikan, meskipun ini memerlukan komitmen politik, dukungan keuangan, dan power ya secara politik untuk dapat menerapkan itu. Tapi kemudian Zina juga memberikan beberapa contoh dengan merujuk misalnya kepada bagaimana negara maju seperti Belanda itu merespon dampak dari COVID ini dengan memberikan berbagai skema-skema social protection kepada berbagai kelompok masyarakatnya, ya. Jadi ada yang sifatnya untuk individu, ada untuk usaha, ada untuk yang wira swasta dan sebagainya. Nah, jadi apa yang disampaikan oleh Zina artinya bahwa jika sistem perlindungan sosial itu sudah eksis di suatu negara, maka sebenarnya dampak dari COVID ini akan lebih manageable gitu ya. Cuma masalahnya memang tidak semua negara memiliki sistem social protection yang memang mampu untuk merespon kondisi-kondisi yang ditimbulkan oleh satu krisis, termasuk krisis oleh dampak COVID ini. Dan Zina kemudian memberikan beberapa contoh terkait bagaimana negara berkembang, ya, termasuk yang ada di Asia, di Afrika, itu meluncurkan berbagai skema di dalam menjamin akses terhadap layanan kesehatan, atau bagaimana mereka melindungi sektor informal, kemudian bagaimana melindungi income security termasuk unemployment protection atau proteksi untuk bagi mereka yang menganggur, meskipun ini masih sulit untuk dilakukan di negara-negara berkembang. Jadi di sini kita melihat ada beragam model respon ya yang bisa dilakukan, tetapi intinya Zina mengemukakan pentingnya yang tadi disebut dengan social protection floor. Jadi memang mendorong terjadinya perubahan di level global untuk menekankan bahwa perlindungan sosial ini tidak ad hoc, tidak hanya untuk mereka yang miskin atau mereka yang rentan, tetapi menjadikan ini sebagai suatu bagian skema yang universal. Itu yang bisa saya sampaikan dari Zina. Selanjutnya saya akan persilakan Bapak Dr. Dinar untuk menyampaikan presentasinya. Silakan Dinar.
Terima kasih Mbak Titi. Saya mohon maaf nih karena agak rame. Okay, thank you Zina for your presentation. Thank you Mbak Titi and also Pak Dr. Santoso ya Mbak Titi ya, from Pajajaran University that have been very welcoming to me in speaking in the webinar. As has been introduced by Mbak Titi, my name is Dinar Karisma. I'm currently working at the Bappenas, the Ministry of National Development Planning, and specifically I'm working with the Directorate of Poverty Alleviation and Community Empowerment. So my presentation will be focusing on what the government in Indonesia have been doing so far in in addressing the situation regarding the COVID-19, as well as what is the next plan for the future social protection of Indonesia. So if you can see here, we have a table explaining the social assistance program that have been expanded by the government of Indonesia during the COVID-19. So the yellow column in the far left is describing it's describing the institution of the social assistance programs, the time period, the delivery mechanism, the total budget. But most importantly, it is also describing to you the target of the people, of the recipient of the social protection programs. You can see that we put it by deciles. So decile 1 is the poorest 10% of the of Indonesian population theoretically. And then decile 2 is the second poorest, the second 10% poorest. And then decile 3 is the third 10% poorest, and so on until the 6 plus decile. So 6 plus decile would be people who are in the decile 60, 70, 80, 90. So those are people that are traditionally not considered as poor and vulnerable. So prior to the COVID-19, we have several programs existing already. We have the conditional cash transfers of PKH that I'm sure you are familiar with. And then we have food assistance and we have electricity subsidy. Before the COVID-19, the PKH was covering up to 8 million families. So beneficiaries here are families. And then Sembako was covering about 15 million families. And they have some sort of subsidy for electricity prior to the COVID-19. And then after the COVID-19, the government expanded some of the programs. The conditional cash transfers was expanded to 10 million beneficiaries. So it was going up to of about 2 million families. The Sembako program increased from 15 million to 20 million families, and the subsidy increased to no longer a subsidy for 450 volt families that has that level of electricity. They were not required to pay at all, so it's free. And then discount 50% of those with 900 volt. But some sort of additional targeting is in operation during on this program. So as I understood, not all of those with this level of electricity got the discount or the subsidy. So the expansion of these regular programs, so we call these regular programs because they have been there even before the COVID-19. The expansion is mostly in terms of the coverage, it's expanding, and also the benefit level, because not only the coverage of the program is expanding, but the benefit is also increasing. For example, the PKH benefit is increasing by 25%, and the Sembako benefit is increasing by 33%. Nothing really changed in terms of delivery mechanism, except for electricity subsidy, because now they are using voucher. And these were mostly early response when the pandemic just started a couple of months ago. So there are issues of adequacy and challenges in expansion. CCT and Sembako are not always easy to expand. And the amount of the benefits are also seen to be inadequate for several situations. So that's why additional programs were created. So these are the non-regular COVID-19 social assistance programs that started after a couple of months. So after those regular programs expansion happened, there are more programs operated by a diverse ministry, not only Ministry of Social Affairs, and all are intended to address the situation of the COVID-19. So Ministry of Social Affairs still took care of most of the programs. For example, food assistance for those living in Jakarta and the surrounding cities, because they are one of the first who got hit by the pandemic. And they were also among the first who got impacted by the economic downturn of the pandemic, economic impact of the pandemic. And then there was cash transfer outside Jabodetabek or Jakarta and the surrounding cities. And then there is cash transfers funded through village funds. And then there is pre-employment card programs targeted. If you can see here that the first three programs on the left, they will stop at the decile 5, while some programs are also available to up to the highest decile, 6+. People in the 6+ decile, they also can receive these programs because we think that the pandemic is not only affecting the poorest, the 50, the 10, 20, 30, 40, or 50% poorest population, but they also impact many people, including those who were traditionally economically secure, but due to the pandemic, they probably experienced some economic impact. So there were pre-employment card programs that are focusing more on providing trainings and are not focused on only the poor population. And then there was some CRAS program conducted by Ministry of Social Affairs, rice assistance, and some additional to the existing cash transfer. There was some assistance provided to the small and medium micro enterprises through the Ministry of Cooperative and SMEs, as well as some wage subsidy targeted to those with income less than 5 million per month and were registered through the employment insurance. So there are several programs that you can see are also available for those who are not poor traditionally and probably working in a sector that are affected, or working in informal economy, such as the small and medium enterprise, small, medium, and micro enterprises. So if you see the breakdown of the programs, then this is more showing you the total budget that the government has been allocating to handle the impacts of the COVID-19. The government budget is still the main source, and you can see that social protection programs is currently the one that is given the highest amount of about 204 trillion Indonesian rupiahs, which is about, if I'm not mistaken, is about 1.5% of the GDP. So the one that Zina has explained earlier, that the less developed countries, they probably wouldn't be able to allocate more than 5% of their GDP to relieve the COVID-19 impacts. That's probably true. However, if you add the total of all of this, would probably be quite a lot, and it's probably reaching about 3 to 4% of the GDP, even though not all of this money go to the social protection programs. So in expanding the social protection programs during COVID-19, we face several challenges that are probably not very exclusive only for Indonesian government, but probably were experienced by other governments as well. For example, our existing data were not updated The last time we collected the data, it was in 2015.
Halo Dinar.
Yeah. Okay. Yeah. Sorry. Yeah. So the updating process was not universal from 2015 until now. So the data were updated in several regions, but not in many regions. So the data that we had were not really describing the latest situation. Many of the poor population were not included in the data because the data was old. It was from 5 years ago. And many people in the database were no longer vulnerable at the time we had to expand the social protection. And the other things is that the COVID-19 impacts many part of the population, not necessarily the poorest one. So many of the more economically secure population groups, they are also impacted. And unfortunately, we don't have the data. The data that we have, we're focusing on 40% poorest of the population. So there are other part of the population, those who are in the informal sector but are not considered poor, for example, that are not covered in the data, and it was quite challenging to expand our social protection programs to those people. The social assistance expansion initiatives were not very coordinated. Implementations were fragmented and targets potentially overlap. As I showed you earlier, that in the beginning, there were only 3 programs that were expanded. But of course, because the expansion was difficult and also the data was not good, some additional programs had to be created. And those programs mostly are not conducted by the ministries that are traditionally providing social assistance. The Ministry of Social Affairs has very long experience in delivering social protection, and they're very capable in conducting it, outreaching and also delivering benefits. However, there are other ministries that are not traditionally sending social assistance to the family level, for example. So there are difficulties in putting together the targeting mechanism, making sure that the targets do not overlap to each other, and making sure that everybody gets at least something to help. The situation is not that easy, so some part of the population may still be left out, and they didn't get some of the benefits. The expansion is also challenging because payment channels are limited. Some of the programs that have been conducted by the Ministry of Social Affairs and were expanded, it took time to expand because they need to do bank registration, for example. And then the bank registration took time, and it created situation that were not favorable at the time. For example, the poor population or the targeted population had to go to the banks, while actually we are suggesting physical distancing, and infrastructure is not always available across Indonesia as well. Some big cities, they have good infrastructure, they have IT infrastructures, they have enough bank offices, they have good roads, so transportation is not a challenge. But some areas in Indonesia, they don't have all of that. So it's even difficult enough for the families to go to the banks to register themselves, for example. The sustainable financing mechanism is not yet available, and the government of Indonesia must reallocate development budget for COVID-19 social protection. There are several big development projects that have been postponed because the money have to be reallocated to fund several other initiatives. And the last thing is that beneficiaries' understanding on physical distancing is low, so cross-contamination risk is high. The way the social system is delivered to the community still create this risk, and it's very difficult to change or to change the behavior of the beneficiaries in a short time, especially when in the beginning of the pandemic, when the urgency of physical distancing was not seen as something very serious at that time, because the number of cases are still very low and not everybody were aware of the risk of the disease. So because of that, we were thinking of changing the way the social assistance programs is delivered in Indonesia. Um, so one thing that we are thinking is to do to propose a social protection reform that has all of these elements: improving data availability and developing social registry, developing adaptive social protection, digitalization of social protection programs, reforming financing mechanism, developing social protection distribution mechanism, and programs integration and coordination. What we are thinking as the main agenda related to the COVID-19. Well, all of these are important, but we are seeing the reform regarding the COVID-19 situation is actually related to the development of the adaptive social protection. So the adaptive social protection is a concept that's basically saying social protection has to be adaptive, expandable, and supporting emergency situations, including natural disaster, social disaster, economic crisis, and health disaster, or endemic or pandemic, or the situation that we are facing now, the COVID-19. So what we are trying to do is to develop a framework that is more supporting toward a social protection system that is quite robust and adaptive and can be used as an instrument of the government to help the impacted population when some type of disaster, including a pandemic, happen. So these are some of the agendas that we are thinking. The first one is we have to improve the data quality and the coverage of the data as well. Improving local government's capacity and mechanism in data updating is crucial. We need to expand database to population at risk of disasters, for example, informal sector, regardless whether they are poor or not. And it is also important to overlay population and disaster risk data. So not only we can identify who are in the informal sector, who are the poor population, who are needing some type of help from the government, but also when we overlay that with disaster risk data, we know that even though some people are probably fine based on the data, but they are at risk of disaster. When the disaster happened, they probably had to change their lifestyle. They probably had to endure an impact that make them unable to maintain the consumption level and had to jeopardy their situation. And then the second thing is to integrate social assistance programs. We need to have a more integrated and coordinated policy making in terms of social protection, in defining benefit and targets, including during the emergency. So difficulties in expanding, in this situation, difficulties in expanding existing programs have to be gradually eliminated. The existing programs have to be very flexible enough to expand. So it can be an instrument that can be controlled in a coordination manner by the government. That's why we are trying to do the digital transformation of social programs to simplify the registration, enabling quick expansion, to expand the delivery channels so they are not limited to several banks or just PT posts, for example, And we also need to eliminating digital gap and improving IT infrastructure. So during emergency situation, social transfer can be expanded quickly. We need to improve the capacity development for the beneficiaries, improving their disaster resilience, their knowledge about disaster, their knowledge about healthy lifestyle, and their ability to face many types of emergency situation, including pandemic. Of course, we need to also provide some empowerment programs for post-disaster, or even like now, when the disaster is still happening and we don't know when this is going to be over. But the economic still needs to going on, and the well-being still needs to be maintained. Integrating expanding social insurance, including the unemployment benefit and LTC, as well as disaster-related insurance. We need to think about integrating contribution, collection, and program management, as well as expanding coverage for all populations, so they have some sort of coverage when a disaster happens. And the last thing is that we need to improve the financing mechanism of the government to have a more sustainable sources. For example, securing government budget or earmarking the budget for emergency situation, or developing some strategies of sovereign disaster risk finance, and several options are available for those kind of strategies, including planning some types of loan that can be withdrawn just during the disaster, or having an allocation previously, so the government wouldn't have to reallocate later when the disaster happened. And there are some types of approach that probably would protect government priorities in terms of their budgeting when the disaster happened. I think that would be all from my side, Mbak Titi and Zina. Thank you so much.
Maybe while we're waiting for Titi, oh, there is she? Are you there? No. Okay, then we can maybe.
Sorry, I think I mute my microphone. Sorry. Jadi Pak Dinar memberikan data dan informasi yang up to date terkait bagaimana peran pemerintah pusat maupun ada beberapa yang inisiatif lokal untuk menyediakan social assistance ya. Jadi kalau tadi Zina berbicara social protection dalam pengertian ada social assistance dan insurance, di sini Pak Dinar mengcover kepada program-program yang bersifat social assistance yang dikemukakan, yang disalurkan kepada masyarakat. Jadi ada beragam yang bersifat reguler yang sudah ada sebelum COVID maupun yang non-reguler yang memang dibuat khusus untuk merespon. Nah, kemudian Pak Dinar juga mengungkapkan berbagai tantangan ya, tantangan terkait dengan implementasi dari program-program bantuan sosial tadi, baik terkait data maupun terkait kurangnya koordinasi, program yang bersifat fragmented dan kemudian masih tumpang tindih. Kemudian juga karena ini sepertinya sistem pembayaran kita karena banyak diubah bersifat cashless ya melalui bank, ternyata infrastruktur maupun sistem pembayarannya maupun saluran pembayarannya maupun sistem registrasinya ternyata masih merupakan kendala ya, sehingga terjadi mungkin agak kacau dalam tanda kutip ya di awal-awal. Kemudian terkait dengan keberlangsungan mekanisme pembayaran dan juga terkait dengan perilaku para penerima manfaat ya, yang ternyata meskipun di dalam di dalam suasana COVID ternyata tidak menerapkan yang namanya protokol kesehatan. Nah, kemudian Pak Dinar kemudian mengungkapkan ada suatu yang disebut dengan Social Protection Reform Agenda yang menjadi agenda dari pemerintah Indonesia, dan ini merupakan satu bentuk untuk menerapkan apa yang disebut dengan sistem perlindungan sosial yang adaptif, ya, sebagai bagian dari itu dengan memfokuskan kepada perubahan-perubahan atau perbaikan-perbaikan di 6 bagian, yaitu membangun suatu sistem bantuan sosial yang terintegrasi, kemudian membangun kapasitas bagi para penerima, kemudian mengintegrasikan dan memperluas asuransi sosial, jadi tidak terbatas kepada social assistance, kemudian meningkatkan ketersediaan dan kualitas serta coverage data, dan kemudian pentingnya sistem digitalisasi, ya, untuk social protection, kemudian meningkatkan sustainable meningkatkan sistem pembiayaan yang berkelanjutan. Nah, jadi itu yang disampaikan oleh Pak Dinar. We have several questions, and the first question is for Zina. The question is from Ahmad Sobirin from the Ministry of Social Affairs. The question is, compared to other countries, is the social protection policy in Indonesia already running well? What needs to be addressed, for example, in terms of mechanism, approaches, budgeting, and implementation, human resources? And the other question is for Pak Dinar. So if the government is the main provider of the social assistance, do you see the prospect of building community-based social protection in Indonesia, and how we can include non-government? I mean, like to reduce the burden for government to provide and finance the social protection or social assistance. So maybe how the COVID-19 can be a lesson learned to promote the community resilience in terms of how they promote the community-based social assistance to help themselves. Yeah, please.
Okay, so I will start. First of all, I also want to say that Dinar, I really enjoyed your presentation. And I think when I hear, when we do a lot of these consulting and these government advice around the world, I think the one thing that makes me feel there is like hope that things will go well is when I hear colleagues like Dinar speak and TT, and I see how they are very aware of the situation. They think global and act local, as we say. So I think that my first question is if Dinar and TT are on board, you guys will do very well. That's the first thing.
Thank you.
Going to the specifics of the answer, I think Indonesia is at a crossroads, because Indonesia, by proof, is one of the countries that once it started to work a lot on its economic growth policies, social protection policies, it does well. There is a structure, there is a government. A lot of the problems that you see in a lot of emerging economy countries isn't there. There's a lot of interest on building capacity. I have personally been part of a couple of programs where people from the ministries have come to the Netherlands to partake in master's programs, short course programs. So that is there. The raw material is there. I think that I think it's running well, but I think when things run well, that just makes the stakes higher and makes the challenge a little bit bigger. So the question is that what needs to be addressed? So mechanisms, approaches, budgeting. I mean, this is across the whole spectrum, but I always think that the best thing is to actually see what needs to be addressed in a short term and what needs to be addressed in the medium term. And actually, from my knowledge about Indonesia and also listening to Dinar's conversation and presentation, I think that, you know, there has to be some sort of, let's say, sort of consolidation and coordination of how social assistance is taking place, and making sure that there's actually inequality across the country. A big part of this inequality has to do with structural reasons. One of the issues that I heard in the presentation is actually, you know, the issue of roads, or how some places are much more equipped than other places. So there has to be, this has to be sort of the base before anything else starts to happen. You already have social services. You already have social insurance. You already have information architecture for social protection. You already have a lot of these issues that are there. And the best thing is usually to improve what you already have. So that would be something that I would actually really recommend, because you have a lot of, you know, you have a lot of wins already. I would actually start by also looking at one of the questions maybe that I think is very pressing, is the whole legislative framework for these provisions. Once you do that, then you start to also see how do you identify also what is the capacity that you're going to be needing, capacity on the ground, but also capacity in policy making. So the exercise, the first exercise, is actually not a very expensive exercise. It's just a very, it's very analytical. And then once you do that, you have to kind of revise and revise how coherent, you know, this national, subnational interaction between the government and, you know, the different maybe municipalities, however this is divided, or how this is broken down in Indonesia. But there also, in my opinion, and I find this very important, there has to be a lot of coordination among ministries, but I think, and government, but there has to be sort of this change agent. There has to be. So I mean, I'm curious who that would be in this case, but I think this becomes a very important issue. And then the last thing I would like to maybe just have a small point about, you know, the financial or the fiscal aspect of it. You know, a lot of the discussions that we've been having in the field of social protection is actually, it's never a problem of budget. It's a problem of regulating budget. It's never a problem of fiscal space. It's a problem of finding fiscal space. So if you think about that, it does also start with a public expenditure review, where you kind of, you know, how you say, you prioritize. And it is about pushing, you know, pushing further this kind of argument that it is about a question of human rights. You know, I will stop just with this anecdote. I think, you know, this is where I think the culture also can become very important. I mean, if you actually think about it, even though we talk a lot about human rights, in the sense that these should be the push for the just society. Actually, I mean, one of the lectures I remember I once gave, I tried to see where you can find really great examples in history about this, about how this is run from a sort of a cultural perspective that you can base it. And actually, you find this you don't find it in human rights perspective, not even in Greek, but actually one of the first structured programs that you find on social protection, you find it in early Islam. And that is fascinating, because then it was based on this whole idea of social solidarity, where actually you have this place that, you know, which I think was referred to as Beit al-Mal, I think, where you start to, you do actually, I find it fascinating, because you do what we are kind of doing. Of course, now we have much more, we have technology, we have better tools, but the concepts never changed. And here, I will answer your question in a very small way, and I will stop. I think Indonesia is already running well, but you know how I always tell my students, I tell them getting an A or a 90 that's a kind of effort. But keeping this 90, that's another kind of effort. So that's a much difficult challenge today, because you have to keep up with that, and nobody can tell you how to do this except if it's from the inside. I completely believe in this. I can come and talk until tomorrow telling you how it's supposed to be done, but it's people that are actually part of the system who understand it are the ones who are able to do that.
Aku tadi udah begitu
And
kali udah pencetin.
I'm done.
Oke. Thank you, Zina. Tadi pertanyaan dari Pak Sobirin, saya mungkin bisa share kepada yang lain-lain. Jadi kata Zina, intinya apakah sudah berjalan baik? Ya, tetapi memang masih ada berbagai tantangan ya yang perlu direspon ya. Zina tadi mengatakan bahwa kita sudah punya struktur, sudah ada layanan sosial, sudah ada perlindungan sosial, tetapi yang paling penting adalah bagaimana meningkatkan apa yang sudah ada. Jadi mungkin beberapa hal yang bisa direspon itu terkait dengan bagaimana meningkatkan kapasitas terkait dengan pembuatan kebijakan ya terkait dengan social protection tadi, karena masih ditemukan berbagai kurangnya koordinasi, baik itu di level antar kementerian ya, yang mengadminister perlindungan sosial dan berbagai bentuknya, maupun di antara pemerintah, berbagai level pemerintahan, apakah itu pemerintah pusat, kemudian pemerintah daerah. Nah, kemudian Zina juga mengatakan ada yang terkait dengan fiskal di sini, pembiayaan. Jadi memang itu bisa menjadi satu tantangan ya, tetapi menurut Zina ini harus menjadi prioritas. Jadi membangun suatu sistem perlindungan sosial itu harus ada komitmen yang kuat ya, sehingga memandang ini sebagai suatu prioritas. Sehingga kata Zina, kita perlu memframe atau mengkerangkakan pandangan social protection ini dalam konteks human rights. Jadi kalau terkait dengan hak asasi manusia, maka social protection itu menjadi entitlement, menjadi hak dari warga negara. Jadi kayaknya frame itu yang mungkin perlu kita dorong ya, untuk menjadikan perlindungan sosial ini menjadi lebih mengemuka dan juga lebih berkelanjutan di Indonesia. Sekarang ke Pak Dinar. Pak Dinar juga ada komentar ya Pak Dinar, selain pertanyaan, katanya setuju dengan, mungkin Pak Dinar juga sudah baca. Ada pertanyaan lagi untuk Pak Dinar, how to involve the local government to make this national donation a success? Because from various cases we often hear that many aid recipients were wrongly targeted. Jadi ada pertanyaannya, mungkin ditambah lagi, silakan.
Pertanyaan pertama tadi apa ya, Mbak Titi?
Pertama, how to promote community-based social protection.
Oke.
Karena kita melihat beban itu terlalu banyak di pemerintah. Apakah bagaimana masyarakat bisa berpartisipasi?
Yeah. So thank you for the questions. Community-based social protection is something that we still encourage, even though we are not. I need to admit that we have not included that as a firm source of social protection in our plan, but maybe we have to. So what we're thinking is now the standard, the amount, and the sources of community-based social protections are still unpredicted in a way. They have high variation. So currently, the government has not included that into one of the main strategy, even though we recognize that that it is one source of social protection. Crowdfunding such as kitabisa.com or other sources of crowdfunding are encouraged by the government, and there are ways to do that. but it is not. It has to be more acknowledged in a way. So what we are thinking is now to include some of these sources as part of the strategy of the social protection in the future. The adaptive social protection is the adaptive social protection framework is very closely related to disaster, and people are quite responsive usually toward disaster, usually when they need to collect fund. So this can be something that that is part of the government strategy, and has to be managed in a way that is more organized and maybe well planned. What we are thinking as a way to help decreasing the government burden in providing social protection is actually um, by improving the participation of the community through a more organized way, such as social assistance, social insurance, or disaster-related insurance. So this way, the fund that can be allocated in managing disaster, including health disaster, can also come from a community fund that is organized through insurance. The second question on the uh, targeting is that we are now developing. So we, in theory, have instruments to collect database and also to create targeting from the database. But of course, because these are instruments, there must be mistargeting, there must be errors, and many other problems with the data that we are collecting. So of course, we can improve the quality of the data that we are collecting, improve the capacity of the local government in conducting the data collection. However, we also need to recognize that there will be some limitations of that instrument. And one way to address that limitation is actually by improving the role of the community in addressing those errors, in reminding the government that there are people that must be targeted but currently are not targeted. There are people that are not supposed to be receiving any type of those social programs, but they are now receiving those programs. So this type of grievance mechanism, of a very fluid updating system that allows updating in real time, would be something that would be helpful for the situation. However, of course, this is not easy to build, and this will take time. But hopefully, this is something that we can go through. I think that from my side for now, Mbak Titi.
Oke. Kita masih ada waktu 15 menit ya. Kita akan selesai tepat pukul 16. So we have additional question, maybe not on the chat but through my private line to Zina about how do you think the social protection at global level in response to COVID-19 address the issues of gender equality and child protection. There is a question about that. Maybe you can share some best practice that may have happened. And there is another question for Zina too, and also for Dinar. I think the question related to social conflict and social jealousy, because in the context of Indonesia, the COVID-19 pushed government to provide responses, and sometimes due to the data issues or lack of coordination, we have like exclusion error or inclusion error, meaning that some people who are eligible but they don't receive the assistance, but those who are not eligible but actually they got it. So maybe you can share some, like idea about how we can address this kind of situation? And also for Pak Dinar, how can the government address all of the challenges associated with implementation, adaptive and responsive social protection in order to fit the objective? Maybe the question is very broad, but yeah. Please, you know, you can share some idea about those in answering this question. Thank you.
Okay. Shall I start about the gender responsive question, and then we can answer together the one for the community, the social jealousy in a country, which I think is a fascinating topic. For the person who asked about the gender part, this is an excellent point. I think one of the interesting sort of responses right away that came out, the UN Women published I think right after, like in the summer, a quick, not report, but like a quick policy document about gender responsiveness, humanitarian response to the COVID-19 pandemic. I'm pretty sure you can, if you Google UN Women and gender responsive COVID response, you will find it. And the idea was that we really need to think about this very quickly, because we are, you know, very worried about women going behind. And I think if I remember correctly, there was priority countries that they wanted to target in this.
Oh, Giant.
And then, and then the idea is that you actually try to really focus on this before you even start to implement, right? So the idea is that women, most affected and at-risk women, actually have to be part of this approach. I think that some countries did that. Some countries were much more proactive in sort of including women. But I think that was a very good move from the part of UN Women. I think the issue was that the nature of the COVID response was so fast-paced that, to be honest, my take is that I think it especially for women, it accentuated the divide a little bit more. I think when we're going to be reviewing this and looking at it, maybe not so much for the case of the children, because luckily, I think this is something just very pragmatic. Luckily for children, UNICEF has been extremely involved in the past years with social protection. I think one of the very interesting trends that we've seen, which in my view really affected how social protection has been sort of really promoted for, is that both the WFP and UNICEF have been completely on board with the social protection agenda. So I think we saw that UNICEF continued doing their work in this humanitarian framework. But I think at the end, what we're going to be seeing is that this pandemic has had, I would say, maybe a more negative effect also as it relates to this inequality between gender. So still not a very positive picture, but I do think it was a bit less for children. I hope this answers your question. Shall I don't know, shall we maybe...
Yeah, you can continue with the other question, answering the other question.
Yeah, so the other question, I think it's a very, I don't think there's a straightforward answer to this. I mean, I think, first of all, I would like to start with jealousy, not just social jealousy. Jealousy is a human nature. I mean, I think this is where, this is a thing we need to deal with. I think the solution to that, if you want to realize adaptive social protection for the whole community, so there's no social conflict, you have to be very transparent and accountable. I think transparency and accountability is very important in times when you want to prevent social conflict. And this is why, this is where this idea of democratic governance becomes very important. And I think that this is where crisis management plans are very, very important. I think a lot of the problems that we see in the world, in my humble view, have to do with wrong, unplanned crisis management when the crisis happens. People get nervous, they don't know what to do. But sometimes actually, if government just goes out and say, we're a little bit, and I mean, I have to say, not because I've lived in a lot of countries, and I think I was very impressed with this whole idea. I was very impressed actually how the Netherlands handled this from a communication perspective, which I think could have also prevented a lot of this. You won't find it a social conflict here because the situation is different, but still there would be, a lot of complaints, and that would eventually end up maybe the parties losing their position. The idea was that you go in and you say, look, we don't know what's going on. We're trying our best, but these areas are doing worse off. This is the numbers that we have. This is the information that we have. You're not going to be able to please everybody, but if you have a clear, transparent, accountable plan that has people attached to it, I think that is a very important step. Otherwise, if that's not the case, there's something else going on, and it becomes a political issue, which is not part of a social protection discussion, right? It's part of something bigger. So this is, I think, where I would. I don't know. I mean, I'm also curious what Dinar thinks about that.
Oke, thank you Zina. Jadi Zina ada poin penting ya, transparansi, akuntabilitas, dan perencanaan yang tepat ya, diperlukan dalam suatu krisis manajemen. Ditambah dengan komunikasi, bagaimana pemerintah berkomunikasi dengan masyarakat itu menjadi penting untuk mencegah terjadinya social jealousy dan mungkin yang akan mengarah kepada social conflict. Kemudian Mas Dinar silakan.
Yeah, terima kasih Mbak Titi. So the question on the adaptive social protection is something that we are also questioning ourselves, because of course this is a new initiative that we haven't started. We can make some indications on what would be the difficulties of Indonesia in developing this scheme. For example, the data that we have is still limited. We have some gaps as well in the disaster data. We have very limited data on pandemic, especially COVID-19. We still need to develop the coordinations between ministries better. And those are in progress. Those are the list of the possible challenges that we try to progress, that we try to address even before we have to implement the adaptive social protections. So this is, well, in general, this is a new initiative. We have indicated some possible challenges, and we are now working on it. But other than that thing, I think we just need to see. Probably one way to do that is to do a pilot project and see whether this works or whether this doesn't work, and then see what kind of improvements we can do, so the program will be more effective. And my presentation earlier about improving the quality of the database, improving the integration of the programs, improving the coordination, those are all of the solutions that we are now currently trying to do in addressing the possible challenges that we'll probably face in developing this scheme. I think that, Mbak Titi, did I answer all questions?
Iya. Kalau terkait dengan social jealousy, social conflict yang ada di konteks Indonesia, how about that, Dinar?
Oh, well, that's a difficult one, because we need to see whether the jealousy comes from because they feel like they are equal in terms of socioeconomic status, but they don't get anything. In that case, that's a targeting program. But if they are economically better and they feel like they should get some attention from the government as well, then this is something that is more difficult. Of course, Zina's presentation on social protection floor that is the ideal one, but that is also a luxury for Indonesian government now. And currently we cannot provide everything for everyone. So what we can do is to always conduct the targeting process in a participatory way. So everyone in either the village or the city would understand that those are people that are being proposed to receive social assistance. If you see the stage of the data collection, you will see that there is one state that's called Musyawarah Desa dan Kelurahan, which means village meeting. So in that village meeting, the village have to decide, village people, and then the government of the village have to decide who are the people that will be proposed to receive social assistance. And through this transparent process, we hope that everybody knows the situation and everybody is aware about why those people are being proposed and they are not being proposed to receive social assistance. And that would improve their understanding in the situation and decrease that social jealousy or a potency for social conflict.
Okay. Well, what a discussion. Thank you so much for Dinar and Zina. And also thank you for, all of the participants. Unfortunately, we shall end this webinar. But apa yang dikatakan oleh Dinar tadi, Pak Dinar, bahwa jealousy itu merupakan satu tantangan ya, karena bisa saja itu bersumber dari mereka yang berasal dari strata sosial ekonomi yang sama, yang seharusnya menerima bantuan tetapi ternyata tidak, maka itu merupakan suatu terkait isu bagaimana membuat targeting itu menjadi lebih baik ya. Dan salah satu cara-cara yang digunakan adalah menggunakan pendekatan partisipatoris di mana masyarakat itu bersama-sama menentukan siapa yang sebenarnya berhak untuk dibantu. Tetapi kalau misalnya jealousy itu berasal dari mereka yang di luar itu yang sebenarnya tidak eligible, maka itu menjadi permasalahan yang lain. Tetapi seperti yang dikatakan, saya pernah membaca satu pendapat bahwa kalau kita menerapkan universal social protection, maka sebenarnya kita itu mengurangi potensi konflik karena itu akan meningkatkan social cohesion. Tapi artinya gini, Indonesia kalau kita lihat dari apa yang dipaparkan oleh Zina dan Dinar, we are there. Jadi kita punya suatu sistem yang merespon dampak dari COVID ini. Tapi masalahnya memang ada berbagai isu yang perlu kita perhatikan dan kita perlu tingkatkan, perbaiki. Jadi paling tidak COVID-19 ini memberikan satu dorongan ya yang sangat kuat kepada pemerintah untuk berpikir mengenai suatu sistem perlindungan sosial yang lebih baik. Dan seperti yang disampaikan oleh Pak Dinar tadi, adanya suatu adaptive social protection yang ini juga merupakan satu tantangan tersendiri, suatu inisiatif yang baru. Yang mungkin bisa kita mulai dengan membuat satu pilot project. Jadi kita mulai dengan inisiatif yang kecil, kemudian nanti mungkin akan dikembangkan. Tetapi paling tidak dari COVID-19 ini kita belajar dari bagaimana membangun suatu sistem perlindungan sosial yang responsif dan juga berkelanjutan. Jadi katanya begini, tidak semua keadaan buruk itu berarti buruk karena kita bisa belajar hal-hal yang positif dari semuanya. Terima kasih atas segala perhatian. So I would like to thank Zina, Nimeh, and Dinar Karisma. Thank you for your time, for your excellent presentation, or your page and your insights you bring to this webinar. Really enjoy your presentation, and I'm sure that we learn a lot from this. And Zina, again, thank you. Pak Dinar, thank you for being available in the short notice. Seperti teman-teman tahu, saya dulu pernah ikut kuliahnya Zina di Belanda, dan beliau sangat so I told about you, Zina. I was in your class, and we kind of have a occasional communication before, but then you know, it's very pleased to be able to contact with you again and see you in this event.
Also, it's likewise. It's the same for me.
Ya, terima kasih kepada semuanya, kepada Pak Santoso, kepada Pusat Studi CSR, Kewirausahaan Sosial dan Pemberdayaan Masyarakat, kepada FISIP yang sudah mendukung, dan juga kepada teman-teman semua yang sudah hadir di sini. Terima kasih, thank you so much. Zina, I think I should contact with you again through email, and also Pak Dinar. So I hope you all have a good day, and thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you, Zina. Terima kasih Mbak Titi.
Ya,
Terima
sama-sama.
kasih, Pak Santoso.
Bye-bye, Dinar.
Sama-sama Pak Dinar. Thank you Bu Zina nih.